So the 28th question is, a 20-year-old girl presents to the OPD with complaints of a progressively increasing swelling on the dorsum of the left wrist. The swelling is cystic and non-tender on examination and becomes more prominent on the plantar flexion of the wrist. So plantar was the wrong typical error, in which there should have been the palmar flexion or volar flexion. The swelling is 2 cm into 1 cm in size. What is the likely diagnosis in this case? Ganglion cyst, sebaceous cyst, dermoid cyst, or the epidermoid cyst. So the answer will be ganglion cyst. So ganglion cyst will be the correct answer. And there are various clues given in this question. The first is a 20-year-old girl. So generally ganglion cysts are more common in young adults, and that too in females. So in females it is more common than males. The second and the most important clue is that its location. So it is located in the dorsum of the wrist. So the most common location of the ganglion cyst is the dorsum of the wrist. So dorsum of the wrist. And generally from where? From the scapholunate ligament. So from the scapholunate ligament. Now the fourth clue is that it's characteristic, like it is cystic, it is smooth, cystic, non-tender, and other features are it is fluctuant or tense. Then other clue is that it has become more prominent on the palmar flexion or volar flexion of the wrist. It is a clear classical examination finding. So that's why the answer will be the ganglion cyst. Now coming to the other options, that why other options are not correct. So the correct answer is A, the ganglion cyst. Why not the sebaceous cyst? So sebaceous cyst is generally not found at that location. It is generally found either in scalp, face, neck, back, where generally the sebaceous glands are present. The sebaceous glands over the skin of the wrist are very few. So that's why sebaceous cyst here is uncommon. Second, generally the sebaceous cyst also has punctum. So central punctum will be given in those questions where the examiner want the answer to be the sebaceous cyst. So examiner has deliberately omitted punctum when they want to exclude sebaceous cyst. Third thing is that it is attached to skin. It is attached to skin, and the skin moves with cyst. Skin moves with cyst. While the ganglion cysts are deep and skin moves freely over the cyst. So that's why the second option is wrong. Now coming to the third option of the dermoid cyst. So dermoid cyst is a congenital cyst. Congenital lesion, and it is found over the areas where there is embryological fusion lines. Classical sites are lateral eyebrows, midline nose, or floor of the mouth. The dorsum of the wrist is not a site of embryological fusion lines. Other than that, dermoid cyst has the consistency of doughy consistency, not the cystic one. It is putty-like, and not the tense. So C option again become wrong. So C is also wrong. Coming to epidermoid cyst. So epidermoid cysts are generally found in the palms, fingers, especially after trauma. So there will always be history of previous penetrating injury, thorn pick, or surgical scar. An epidermoid cyst lies in the subcutaneous tissue. And it does not become prominent on flexion. So it does not become prominent on flexion. So they are generally, epidermoids is a traumatic implantation cyst. So D is again the wrong. So D is wrong. So the correct answer will be the ganglion cyst. Coming to the next 29th, which is again easier one. That upper motor neuron lesion. So there is a UMN lesion. Upper motor neuron lesion is characterized by which of the following? Increased tone spasticity, hyperreflexia, absent plantar response, or motor weakness. So the first option is correct. There is increased tone spasticity. So we generally know that UMN lesions have increased muscle tone. The resistance is velocity dependent resistance. So there will be clasp knife phenomena. So in human lesion there will be increased tone spasticity. Human lesions like stroke, spinal cord lesions. So in that, increased tone spasticity will be there. So the first is correct. Coming to the second option, hyperreflexia. So in this, the deep tendon reflexes become exaggerated. So this is also correct. So they become deep tendon reflexes become exaggerated. Why? Because descending inhibitory pathways are lost. So there will be brisk knee jerk and sustained ankle clonus. So second option is again true. There will be hyperreflexia. Third option is absent plantar response. This is incorrect. Rather, there will be extensor plantar response. Which is also known as the Babinski sign. In which normally the plantars are downgoing plantar, or we call it flexor plantar. But in case of UMN lesion, there will be upgoing great toe or extensor. So third is incorrect. Coming to motor weakness, yes, UMN lesion causes pyramidal weaknesses, and so there will be the motor weakness. So correct answer will be 1, 2 and 4. So this is the correct option.